Granth. I am one of the folks involved with Chicago Health Coalition for Black Lives. And we're here with Dr. Murray today for just a nice, fun, informal conversation about organizing. I wanted to get started. I'm going to be reading a little bit from a script for a second. So if I'm gazing off into people's souls, that's why it's happening. So just so you know. I wanted to start this with a land acknowledgement. So we wanted to start by saying that the institutions that we work in and are a part of are settler colonial structures on land stolen through genocide against Indigenous communities. These structures have and continually exploit Black and Indigenous people, and we must be cognizant of that when we have conversations about racial justice. These conversations are intrinsically linked to conversations for Indigenous sovereignty and self-determination and conversations about transnational solidarity and liberation. So I want us to spend a minute or so to just think about that as we are moving into this conversation about organizing in medicine. Some quick guidelines for everybody. So during the talk, we are a small group, so if you want, feel free to turn on your video. It's completely optional. Please remain muted during the talk. If you've got questions at any point, type them into the chat. We've got some folks compiling those questions, and we'll present them to Dr. Murray at the end. And there will be some time for questions at the end as well to ask. And if you have time after, please stick around for like a 15 to 20 minute informal debrief where we can kind of just talk about everything we talked about here and kind of synthesize and plan for next steps. So I want to introduce the lovely Dr. Murray. Thank you for being here, Dr. Murray. I'm going to read from the script for a quick second. Dr. Murray spent her career serving the medically underserved, patients most impacted by structures of violence. She's worked in and also served as leadership in several organizations that advocate for Black and Brown people, workers, and people most exploited by a capitalist American society. She worked at Cook County Health and Hospital System, one of the nation's largest public healthcare systems. She's been a leader in public health organizations, including as the former president of the American Public Health Association in 2011. Today, she serves as an honorary attending of Cook County Health and is an adjunct assistant professor at the University of Illinois School of Public Health in Occupational Environmental Health and Health Policy Administration departments. She serves on many local and national boards, including the Chicago-based Health and Medicine Policy Research Group, and chairs the board for the National Collaborative for Health Equity. She remains passionate about increasing the number of Black and Latino health professionals and serves on the Urban Health Program Community Advisory Committee at the University of Illinois. Dr. Murray is devoting the rest of her career to being an enthusiastic, full-time troublemaker. She's been a voice for social justice and health as a basic human right for over 50 years. We're really grateful to have her here this evening. So, hi, Dr. Murray.
Hello.
I am always in awe of all the work that you've done. And as someone, and echoing a lot of sentiments for people on this call, as people who want to be full-time doctors and troublemakers ourselves, we wanted to kind of just hear from you about the lessons you've learned throughout your career and your time, especially as someone who's been in Chicago for such a long time as well.
Well, first, let me just start off by saying that all of you should be congratulated. You all have scared the shit out of administrations all over the country. You don't believe how many calls. I got a call. I was on a call the other day from Northwestern Medical School with an order from the dean. How can they be an anti-racist medical school? So that's only because of the students. And more importantly, because each generation of students has a group, usually a minority, that tries to be active. But you happen to be in medical school during these particular times where you have a broad movement coming to the forefront of American thinking. So I'm an old person, and therefore some of the language I use is not the language of today. And some of it wasn't the language even of my youth. So let me just say that I think when I was young, there were a couple of strange slogans that was out. One is, you don't trust anybody over 30, which I always thought was stupid because I figured I wanted to get to 30. So I was saying, like, oh, it doesn't sound right. But the other thing is, I graduated from high school in 1966, and there was a great deal of pressure put on me specifically, by older people in CORE, one of the northern civil rights organizations in Cleveland, where I was, to actually go to the South and join either SNCC or some other organization and be a, quote, full-time organizer. And so I didn't do that, because, and so what I'm about to tell you comes from that fact that I didn't do that, because I said to myself, well, what are they organizing for? What do they think is going to happen? I mean, I wasn't against people doing that, but I'm saying, like, if I go down there full time, we're not going to win in a year or 4 years or 10 years. So what I should do is try to get some skills so that if we ever win anything, I can help build that. So if you think of organizing as a separate activity, I think that gets you in trouble right away. There's clearly organizing skills, but frankly, particularly medical students, not exclusively, but graduate students and students that go to competitive schools, they already have a whole set of skills. They may not call it organizing. All those extracurricular stuff you all had to do, those are organizing skills, okay? It doesn't really matter whether you're organizing for the Girl Scouts, which I actually was in when I was little for a hot minute, or whether you're organizing for a fraternity or a sorority, or whether you're organizing for clearly political, anti-Vietnam War, civil rights, etc. Things. So the organizing skills, the actual skills, are neutral. That is to say, the skills part of it, you could be organizing for fascism. That requires the same level of skills. So I think the first thing I would say is, what the hell do you believe in? And if you believe things are messed up and you want to spend time trying to change that, then you're not talking about, I'm going to organize while I'm in medical school. You're really asking a lifelong question. How do you stay politically active and engaged as a human being over your whole life? And what you do over that time span changes. And my advice usually, especially to people in medical school, but in general, is you start where you are. There are some people that deliberately leave where they are and go to a different country. I'm not against that, something I've never done, or feel so passionate about a specific issue that they're not really connected to. Again, I don't have a problem with that, but most people who are successful organizers start where they are. So if they're working in a grocery store, they may organize a union. If they're a student, they hopefully are working on making their education experience better. So you're in a funny position because you're not only in students, but you're also working in the second largest industry in the United States. So that's what I would say first, that don't think that this is something, don't consider this like a mission. That's really what I'm saying. Don't be a missionary. If any of you are religious, I'm not trying to, but don't be a missionary in the sense that you're going to take what you believe and go somewhere else. What you need to find a way is to make what you believe part of your regular life. And so for me, I never felt like I had a choice to not organize. And I think, I say this frequently, but it's actually a true story. My great-grandmother always told me, white people are always going to knock you down. And the only thing you have to ever decide in life is how often you get back up. And so I never felt that I had the option or the privilege of not being politically active. Because even if you're not visibly politically active, you're just getting your ass kicked all the time. So, I mean, I didn't feel like there was a choice.
Sure. No, I completely hear that. I think there's a lot that you're saying there about how just your existence alone is political, but that also politicized you to want to continue to organize and continue to be involved as a lifelong organizer, as a lifelong activist as well. I think one of the things that comes up a lot, and this is a question that we had posed as well, but something that I see a lot is there's a lot of people in medicine who kind of feel I don't like using the word paralyzed here. I'm not sure for lack of a better word, I will use that, where they feel like they don't really know how to get involved or what to do. And I feel like a lot of that has to do with the fact of how we're educated. I feel like the way that we're educated a lot, it tends to feel very apolitical, very detached from reality. And so how do we, as people in medicine and as people who want to pursue this as our careers, go about unlearning that process and seeing and being explicitly political in that not only as people who see like that the world is fucked up and we need to do something about it, but also that yes, we need to do something about it, and we should also be doing something about that outside of and within medicine.
So to me, speaking clinically for a moment, you got to make a diagnosis. You got to make the right diagnosis. So it is not possible to be apolitical. It's in my mind, it's literally impossible. Now you can not be visibly active, but even that choice is agreeing with the status quo. So you can't get out of it. You are political whether you want to be or not. And certainly medicine is political whether you want it to be or not. So I think it's always better to be clear what's going on and to have a diagnosis what's going on. Now, I suppose if you're really happy with how the world is and how your part of the world is, you can not seek to change it. Yeah. But that's still not an apolitical position. That's a political position that says I'm going to continue in my nice role, which automatically reinforces the status quo that I'm happy with. So what I would say, and to me this is true all the time, if something is pissing you off, take a moment, and you don't have a lot of moments. It's not like this is done linearly. It's not like take a moment and understand what's going on and then change it. No, because everything changes. So, how racism is expressed today is different than how it was expressed 50 years ago. Mm-hmm. So it's a constant process of analyzing and being thoughtful about what's going on, what's changing. What the hell is the enemies doing? Believe me, they don't sit around not doing anything. They're organizing also. So what that means in jargon, let me say it to you in jargon. You have to have an analysis of how you think the world works before you can make a decision that you want to change how the world works. Yeah. So again, but underlying your question is really a different question, which is, I'm not quite sure where to start. That's a different question. Okay, then I don't know if I want to be political or not. And that's a tricky question. And I think the challenges of your generation still today are different than my generation, because in my generation, we had a whole range of nationally structured, traditionally hierarchically structured organizations. And if you didn't like any of them, you could go out and start another one if you wanted to. I think in the past 20 or 30 years, we've lost those national organizational structures that are overtly political, mostly. And so then it becomes a trickier question of where do I pick my battlegrounds and what do I work in? And these are choices. It's not like a right choice or a wrong choice. So for example, as a Black physician, I've never been a member of the AMA. I intend to die having never been a member of the AMA. I have colleagues and friends who are of my age who are members of the AMA. That's fine. They choose to work in organized medicine. I choose not to work in certainly in the AMA or even in the Black Physicians Organization, though I'm a member of that. But I've not worked in those organizations as my political structure. So you can pick. You don't have to pick one thing. I know physicians that don't do anything with medicine, that are very, very, well, everything is healthcare, but who are very, very active. So what I would say is, when you don't have a lot of time, when you have kids, you're new in a career, you start where you are. That's easier. So it's easier if you're a medical student or a resident or a young physician to work in healthcare, because that's where you're spending so much of your time anyway. So if you're working at a health center and you're trying to figure out how come your patients can't get the care you think they need, you might as well do some political work there in addition to, you know, trying to make sure you have a good quality program, which is clearly important.
Sure. I think, wow, thank you. There's so many things that I want to jump off of. So I like wrote down a little bit of a list, and I'll start at one, and then we'll see where we go from there. I think one of the things that you mentioned really early on was how this political moment is unique in several different ways. And I'll just name a few. I mean, there's a lot of the organizing that's been happening specifically in a lot of large cities, but nationally to defund calls to defund the police. There's been, I mean, I don't know if people saw the news, but the Dakota Access Pipeline has been shut down as of yesterday. It needs to be shut down. I forget the exact
temporarily shut down.
Yes, temporarily, but still a big win.
Mm-hmm.
And I think there's a lot of people talking about how all of these, there's COVID obviously, and COVID and how it's impacting workers on the front line. I think one of the things that I'm feeling with all of this is people are seeing a lot of the intersections here, that people are starting to see how all of these things are linked. And I believe that there are some parallels with other historical moments. And I wanted to get your thoughts on that, of what this political moment reminds you of.
Well, first, I will say every moment is unique. So that's the first thing. And every moment is a result of previous moments. So they're not unrelated. I think that, you know, whatever work you do, it helps to have a clearer understanding of the history of the issue that you're working on, and an understanding of the movements that tried to change whatever you're interested in over time. So in my sort of crude arc of, I'm not a historian, but in my crude arc of American history, Reverend Barber talks about, I'm not sure I agree that there are only three. He talks about this being the third Reconstruction. I think it may be the fourth, but you know, you have the Reconstruction after the Civil War, and significant progress being made, and then that progress being pushed back. So that's the first lesson to learn. So just because there are all of demonstrations that we've seen in the past 6 weeks, is unprecedented in the history of the United States as a whole, taking it as a whole. But there have been times when we've had huge, amazing demonstrations. In 1917 or 18, can't remember which year, in New York City, they call it a silent march or a silent protest. Now, remember, this is 1917 or 18. So the fact that you had Black people marching in the streets of New York City is an amazing thing anyway at that time period. But you had 10 to 15,000 people in a silent march, segregated by gender, with different, the women wore white, the men wore black, in suits. This is 1917, so they dressed up in their Sunday best. And you had an equal number of Blacks on the streets of New York City observing the march. This is in 1917. And this was really it was against police brutality and terrorism and lynching, okay. I don't think those people that were in that march then would have guessed at all that we would still be out here doing the same shit today, okay, 100 years later. Yeah. So we have the original Reconstruction, and this is a part I think we don't give enough credit to, is the period, the so-called progressive, some of you may be history majors, you can help me out, the progressive era of American history, you know, right before the Depression, where you had unions going up. So there was a lot of activity. Women got the vote. There's a lot of political activity then. This silent protest march occurred. We don't talk about that very much. Now, when I was young, as part of what we now call the civil rights movement, it was clear to me that we were like the second civil rights movement, that period, Jane Addams, that period preceded me, the quote, old left. That is a period that preceded me. And so I could talk to people who were active in things when they were young. And then we have the so-called modern civil rights movement. And now we're here. And so the question is, will this be another movement to make progress like those other three have?
Mhm.
So having some sense of the arc of history, which is hard in this country because we don't teach history, but it's hidden in the libraries. You can go find it there.
Sure.
So that's where they always hide stuff.
Yeah.
So I think the first step for anybody that's going to be an organizer or an activist is learn some history, and it's a never-ending process. But start off understanding the history of what you're worried about. So, for example, understand the history of our industry and our profession.
Mhm.
You know, why is American medicine different than other Western medicine? And I don't even know why Western medicine is different than so-called non-Western medicine. You know, my language skills are such I haven't been able to research that. But
Yeah.
what are those differences? How did the professions grow up? What's our relationship as physicians to the other? I consider us a feudal industry in many respects. Okay, we have our little caste systems, and so if you start understanding the history of where you are, of medical schools, of the medical professions, of how the other health professions have evolved, what's the relationship between them, then I think you're in some better chance to talk about change. So when I was a young professional, early in APHA, we supported the Dellums bill, which was much more progressive than anything we have now. Nixon's plan was more progressive than anything we have now. Actually, Nixon's health insurance. So understanding that, that Nixon put forward a proposal in Congress that was more progressive than the Affordable Care Act is an important thing to understand if you're trying to change how medicine is practiced in the United States. But for example, in the Dellums plan, there was this concept of getting rid of the feudal walls, that if you started off as a poor working class person and maybe you were a nursing assistant, that you wouldn't have to go back to zero every time you changed. So you may start off as a nursing assistant, but you would be able to be a registered nurse without starting at ground zero. And if you were a registered nurse, maybe you shouldn't have to start at medical school at year one. So there would be some possibility of going up a skill ladder without starting all at ground zero again and without having one track. I remember at the University of Illinois, I don't know how many of you are students there, I served on the admissions committee. When I was there, we had students from every year on all the committees, including promotions and admissions. So there were 4 of us for each year on the admissions committee. And there was a young nurse who was very highly thought of. I had heard of her as a student, who was an ICU nurse at University of Illinois hospitals. And she had a bachelor's in nursing. I can't remember if she had a master's or not. She had gone back and taken some probably biochem or some other course she didn't have. And she was applying to medical school. She was a white nurse. And I remember her application came up to the admissions committee. And all the faculty on the admissions committee said, well, she's a fantastic nurse. She's already a health professional. We're not going to let her in. And I went crazy. And I said, what do you mean you're not going to? And they said, Linda, she's not Black. I said, I don't give a shit. So, no, what do you mean you're not going to let her in? She's already teaching half your residents, you're telling me. You should let her in. And so it took 2 meetings, but we actually got her in. So that concept of a ladder changes how we think about the health professions. That exists in every field. And even though it may not sound, quote unquote, radical, it often is. It's often those kind of changes that change the structure. When we talk about structural racism or structural factors, that's what we're talking about. What are the structural rules baked into how we do things? What is it that says if at 18 years old, for whatever reason, you decided not to try to go to medical school and you went to nursing school like any good young woman should, that you couldn't change your mind later and switch? So understand and make a good diagnosis. Understand how the system works where you are, because until you understand that, you don't know how to dismantle it.
Yeah, I'm hearing a lot of that. I think one of the things that came up when you were talking about this is the piece of like, you should really spend the time to learn history. You should spend the time. I think one of the things that people struggle with, um, myself included at times, is that in this moment, it's like everyone has the energy, everyone's really excited, everyone wants to do something. When that moment lulls, how do you keep yourself from feeling like you're kind of walking in this alone? What kind of intentional connections do you need to be making with people in this moment, to build like a sustainable kind of learning process and growing process and organizing structure as well?
Well, you often don't have the luxury. This is going to happen in a messy way and concurrently. So it's not like you can, oh, let me read all this history and then I'll go out. No, it's just like when you have a patient. You have a patient,
Yeah.
maybe you've never dealt with a diabetic coma before. You get a patient, and all of a sudden you have to pay attention to that information. This is what organizations are for. And again, I'm of a gen now. I haven't been in a major organization. I used to be in the Communist Party, but I haven't been in a major organization for decades. So if you're not in an organizational structure, it becomes difficult. Let's be clear. But you don't have to be in a lifelong organizational structure. You can, and I belong to many organizations. So that's one way. And then the people you work with become your friends. I don't mean just in a job, but I mean the people that you work with, whether it's around a school issue or defunding the police or getting the cops out of your kid's school.
Yeah.
I mean, they become your friend. Now, the reality is, for you psych majors, people get alienated. I mean, it's perfectly normal to feel like, what the fuck is going on and what should we do? Which is how I feel most of the time. I mean, because it's because we keep losing.
Mm-hmm.
Okay, you all don't get to say that yet because you're too young, but I can say that. I can say that when I was 18, I was involved in 1966 a rebellion in Cleveland. The National Guard came out. We were out in the streets talking about end police brutality. Now, our slogan, which I like better than you all's today, was "Off the Pig." That was our slogan, which I thought was a much more satisfying thing to shout in the street than abolish the police.
Yeah.
But in any case, so a few weeks ago, my 18-year-old granddaughter went out in the streets on the same shit that I was, So like, this is not a uplifting time for me, because I'm sitting here looking at her and I'm saying, like, what happened in this 50-odd years? Have we made any progress? And when I think back to 1917, the silent protests of 1917 that I just told you about, what's happening here? So I think one of the issues that I feel less, when I was younger, I felt very anxious about it. So I don't think you all are crazy. As I got older, because it keeps happening, you sort of get used to it. You sort of figure out, oh, this ain't changing. You're going to be wondering, am I doing the right thing? Did I waste time in this? And sometimes you will waste time in an organization. I'm old enough that I've seen organizations disappear, okay? Or become things that I don't want to be associated with any longer. So trust me, that's going to happen. The question is, what are you centered on? And do you feel you have a choice? Your attitude, those of you that decide to have children, you'll find your view of life changes when you have children. You begin to think in terms of what they might do, or be able to do or not be able to do. So I don't think all the answers are not going to be there. That's what it means to be a young physician as opposed to an old physician.
Yeah.
It's just that the old physicians know this is. So let me tell you one story. I'll tell you a lot of stories. Let me tell you one story.
We love this.
Hopefully you'll all resonate with this. One of my granddaughters, she's 21 now. She just turned 21. When she was 16 or 17, she had a fight with her parents and her mother, and as is typical for adolescents, right? And one day she escaped to my house because like they were going to kill each other. And I'm sitting here talking to her, and as a grandmother. It's very different than being a mother. Much more fun, by the way. If you could become grandparents without being parents, do it. It's much easier. But anyway, I'm sitting there talking to her, and she's, you know, I shouldn't have to clean my room. They're so stupid, you know. And you know, she's 16. I'm saying, like, well, you know, you're only 16. You can't support yourself. Your parents are really right. You have to learn how to, you know, you have to learn how to get along with it. You should at least talk to them. Tell them how you feel. I'm not talking to them. They're so stupid. So then I say to her, but you talk to me. And now, mind you, I'm having a united front with the parents on this particular instance. I said, you talk to me. All you have to do is talk to them. And she looks at me and she says, they think they know everything, Linda. You know that you don't know anything. And that's the fundamental difference. I realized she was, so that's what eventually you'll get to the point where you'll realize you don't really know what the fuck is going on, and you'll be at peace with that as you make your decisions. When you're young, you think you're supposed to know what's going on. You're supposed to know what to do. You're supposed to be connected with everybody. Sometimes it'll be like that. Sometimes it won't.
Okay. Wow. I'm just going to let everyone sit with that for a second because that hit me pretty deep. I wanted to also touch on some of the other things you said. Trying to remember how I want to phrase this. You mentioned being part of organizations, or like, you know, you said like sometimes you feel like you might be wasting time, and that's going to happen, and you're going to have to, and you know, as you said, you got involved in organizations that you felt like you don't really believe in what they stand for. I feel like one of the things that a lot of us here on this call are kind of getting involved in is like, as you said at the beginning of the call, Northwestern called you up and said, how can we like build like an anti-racist like curriculum or whatever, and like a task force to do that. I'm kind of in this place right now where I just feel like the anti-racist task force, anti-racist whatever that all these schools are trying to do is just the new like diversity, equity, and inclusion stuff that they were doing like 4 or 5 years ago. So, and like if you look at them, the missions feel the same, everything that they're saying that they're going to do feels the same, and it just feels like a lot more of the same status quo. But a lot of students, myself included, feel like, oh, that might be a good place to start to get involved. When we get involved in that and then we feel disillusioned, where do we go? What do we do next? How do we pick ourselves back up from there?
Don't allow yourself to be disillusioned.
Okay.
Understand that you're not going to have an anti-racist medical school in the next decade. It ain't happening, okay? I'm going to try not to be pessimistic. Maybe it'll happen eventually in you all's career, but it's not going to happen in 3 years or 4 years or 10 years, right? So what you do is you add to the struggle, okay? Again, when I was in medical school, we had this course that the students did. They didn't get any called The Realities of Medicine. Just what is medicine really like? Because what y'all are teaching us ain't what medicine is really like. So when you work on the curriculum, first of all, don't just work on one thing, you know. But when you work on curricular changes, you're going to make things a little bit better, hopefully, for people coming after you. So hopefully students that come after you will they'll learn a little bit more about stuff you had to teach yourself. Okay. Yeah. So that's the reason, because the reason you're doing it is not really to help yourselves, because it'll be too late by the time they get it together. At any level, it'll be too late. You to have an anti-racist medical school, you got to have anti-racist faculty, right? And you know that's, you know, so concentrate on, and that's why I like the word troublemaker. Concentrate on causing as much trouble as you can. Cause as much change as you can. Force the institution to look at as much as they can. And so, for example, at this particular meeting, even though the meeting I was at actually wasn't about curriculum, though I said something about the curriculum. I think it's about community engagement or some nonsense like that. But one of the things that I said was, well, if you all really want to be anti-racist, raise the pay of your staff that don't have MDs after their name and our colored folks. For example, I mean, if you want to be anti-racist. So again, if to the extent that you can move people to do that, have scholarships for people that are DACA identified, you know. So you can always, so to me, I consider myself, I try to be a radical. So what I try to do, even if I'm working on something that I know is bullshit, like, like I'm working on now a course for the School of Public Health because the students fought for it, racism in health. Okay. But if I can put in that little jive core, do I think one course isn't going to do it? That's, you know, but if I can put in that course some, you know, hand grenades, secret hand grenades that are going to blow up in students' minds, you know, I'm happy. You know, if I can get a few more faculty to read some of these things that we're talking about, that's a good thing. So, and sometimes you get surprised because sometimes, like now, all of a sudden, all over the country, people will be in the streets. I mean, we did this with previous murders on taped on the phone. You know, we can list all those names came from people. Those are people we know about. So one thing I saw Angela recently on some webinar, you can't predict when shit blows up really like this. You know, you can't, like, what can I say what's different? Now you can say some things, we have a global pandemic or whatever, but the point is you never know when things are going to break loose. So you always work as though they might. And you always have to build.
Yeah.
The APHA, our young people in APHA fought for 3 years to get a simple resolution that said that police murders were too much and they should be stopped. We should be against the police murdering people. And let me tell you, the first year or two that this came up, it was defeated. And the reason why is because our great faculty said there's nothing in the peer-reviewed literature. They dished the resolution because they couldn't quote any peer-reviewed literature because there was none. But they quoted the best data source that existed at the time, which happened to be the Guardian newspaper.
Guardian database, yeah.
Right, exactly. Which actually was very well done, and but they, so superficially looking at nonsense. Yeah. Today, people, I don't forget, and the students haven't forgotten, but today, APHA has proudly on their website that we have this policy about police, even though most of the organization didn't want it. Well, I don't know, I shouldn't say most, that's not true. Within the government, within our little structure that we use for passing resolutions. Mm-hmm. So you could easily think, as many of the young people did at the time, this is a waste of our time, fuck this organization, they don't want to say this, we should just leave. And I said, well, you know, if you want to leave, you can leave, but we still want to push this, we want to try to get it through, because one day we will need it, okay? Yeah. So what you all are doing now, it's not going to be the revolution. It's not going to happen right now. Yeah. But that's okay. One day it will happen, and it won't happen unless you make a contribution.
Yeah. I wanted to ask you, I know I keep circling back. It's just because you say so many great things, and I feel like I need to go all the way back to the beginning of what you said to get to another point. But one of the things that you said at the beginning of this was kind of about starting where you are. I feel like there's a lot of residents right now interested in organizing. There's a lot of residents in our organization. There's other residents who we've talked to who've expressed this interest. They want to get involved in like resident organizing, like labor organizing. And I know that you were a student around the time that the large Cook County resident strike happened in 1975. I was wondering if you had any thoughts or lessons around strategies, politics, things that residents today should be thinking about as a part of their labor organizing.
Yes, so it is true in '75 when the House staff went on strike at County. I was a medical student, but I knew House staff leaders, and I became. When I was at County, I was the leader of our union for 2 years, which is unusual. We had a tradition of having someone be the president in their second year as a resident. But unfortunately, when I was president, we actually ran out of money, like literally in the bank. So we had an unusual situation. In that era, there were House staff unions around the country, mostly centered in public hospitals. And at one point we had a national union, not separate and apart from the AFL-CIO. But it was it's a hard structure, so we lost that structure. So we built the structure up, but we lost the structure. We had to dissolve because we lost a few of the unions, and we lost the ability to have that structure. And then time passes, and now most unions that are in house staff and graduate medical education people are part of SEIU. Coming out of 1199. So the New York Interns and Residents Organization went into 1199 early. Finally, the house staff at county are part of SEIU. So SEIU has in it physicians, both attending physicians, but they also have what the remnants are of the house staff unions are. I think one thing that was important was when you're organizing students, and even though we always said residents weren't students, but they're time limited. You're only there for 3 years or 5 years or whatever your program is, that it helps to have a national structure that goes beyond when the individuals rotate in and out, that has some institutional history. It helps to have a professional organizer, which these unions generally have now. And it helps to run it like a real union, even though it's still problematic because your membership, it turns over completely every 3 or 4 years, which is a challenge if you're trying to build skills, etc. So for house staff people that want to actually do labor organizing, I say, yes, that's the first thing you ought to do. The first thing you ought to do is have a good labor union, and that you need to reach out to other house staff in your area, wherever they are, and see if, certainly in Chicago, like I said, I think Stroger may be the only hospital with a union. And they'll tell you they're part of SEIU. That makes sense to be the same union. If you're in a part of the country where there's more than one union, fine. I think it's better in the long run if you're going to do labor organizing, if you're part of one of the big healthcare unions. AFSCME, SEIU, there are a number of unions that have a large healthcare component. So knowing that ahead of time, going there, going to that international and saying, we want to organize a union here, and you might get some help in how to do that. So I would certainly encourage people to do that, because that's starting where you are. Yeah. And obviously for counties union and for most of these house staff unions, the major thing that they've always looked at has been conditions for patient care. Not that working conditions are unimportant, but the main reason people put it, because you can tolerate any shit for 2 or 3 years, you're going to be gone. But the real motivation for having those unions and keeping them strong is to in fact have good patient care for your patients.
Yeah, that's super helpful. I think that's kind of what we've been thinking about as well. And so I think that is that's kind of the direction that people seem to be going in, at least with the folks that we've been organizing with here at Chicago Health Coalition. I wanted to ask one last question, and then I think I'm going to open it up to audience questions. I think we're ready to do that. I think one part of the organizing where you are that I struggle with is I feel like a lot of people, when they want to organize, they feel like they have to organize only within their school, or if it's residents, like only within their hospital, or like kind of within healthcare and only within healthcare. I guess my question to you, and this is actually Sophia's question as well, I didn't realize in the chat, what were ways that you and your comrades took to the streets as clinical folks? So like, what were ways that you brought the skills you learned as clinicians into organizing, and how did you bring that to the streets? I know there's a lot of folks today trying to do street medical work, and that's not new. We know that that's not new. Mm-hmm. And there are people working in other like free clinics, like and doing that, and that's also not new. So I kind of wanted to hear from you how you and your comrades did that.
So I think this becomes critical. You have to have, I'm going to call it you have to have a political ideology, but don't think of it that way. You have to have a worldview. You have to have in your head a worldview that you're comfortable with. Yeah. And so it's interesting. So let me go back to some of my earliest organizing activities, which which now I would argue was healthcare organizing, even though at the time I couldn't spell health and had no intentions of going into medicine or anything. So the first thing that I worked on to organize as part of student corps was actually rent strikes in one of the slums in Cleveland, not somewhere where I live, just a rent strike. And as young high school students, what could we do? I mean, obviously we weren't putting anything on the line. So we did, we ran the mimeograph machine. These are old fashioned things. I'm sorry. We ran the mimeograph machines and we handed out the flyers. So rent strikes, the other thing that we organized around, which did make sense to me, was stop signs. Okay, now did I think this was revolutionary? No, but kids were getting hit by cars, and certainly I had friends that were hit by cars because there weren't stop signs in the street. Today, I would argue those are fundamental public health activities. I'm a public health professional, so to me, everything's public health. Yeah. When I was young, we organized, starting with that student corps chapter, a citywide boycott of schools in Cleveland, Ohio, around disparities in education and a failure to integrate the schools. This is the campaign around which Reverend Bruce Klunder was killed, who's one of the martyrs called out on the Civil Rights Memorial. So the connection, but I was a high school student, so I'm working on an issue that impacted us as high school students. We weren't getting good education. So today, again, I would call that basically public health organizing. I didn't call it that then. Okay. So I think that what you think your organizing activity is in now is it's not necessarily what it really is. But if you are sane, and I know that's difficult as a medical student, but if you're sort of sane, you should have more in your life than simply medical school. So in college, I did other kinds of organizing. The Vietnam War was going on. We organized around that. But there are lots of other things. Again, like I said, I really had never had an intention of going into healthcare. When Fred Hampton and Mark Clark were murdered, I was still in college. And one of the things we had on the South Side was something we call a communiversity, which was like a Saturday program around all kinds of stuff. And one of my friends was a registered nurse. She wasn't a practicing nurse, but she was a registered nurse. And we were young. So I remember she and I did a course on first aid. What do you do when the man is outside your house with guns? It was the 60s, So. And I unfortunately, I remember we both got a call because we did these first aid programs for a while. We got a call from the Panthers. They were afraid. They were right, of course. They were afraid they were going to get attacked by the police. This is before they came in and murdered them. And they wanted us to come to provide first aid. And we said, yo, if the police are going to come and attack y'all, you don't need first aid. You need some guns or you need something else. You don't need first aid. So fortunately, we weren't there. We didn't go there. So if you have kids, you may be involved in that. If you live in a neighborhood and gentrification is going on in your neighborhood, or the neighborhood bar is acting problem, or you have a playground where people are serving drugs. I mean, there can be other things in your life, even as a medical student or a young health professional, that may not be directly around medical care. It's okay to be active in those things also. You can bring to bear, though, whatever clinical skills you have. We obviously provided medical support for conferences and conventions and demonstrations. That's a skill that one has to learn how to do that. It's not different than being medical support for a goddamn marathon, but it's still a skill that you could go ahead and learn how to do. So when you look at when organizations call recently about what do all these COVID statistics mean, what does it mean when they say these many Latinx are dying from COVID? So even those kinds of skills, this is what this means. This is how they usually talk about that. So you already know quite a bit that organizations that are active can find use for. But they're not going to call you up, because after all, you're still baby doctor. They're not going to call you up just because, you know, you got an MD after your name or something. You have to have a history. They're only going to call you if they know you from something else, that they have some level of trust in you. Okay. So when a congressman calls me, they're not calling me. Yeah, I mean, I have a lot of bullshit after my name, but, you know, I'm not the dean of the School of Public Health. They could call other, but they call me because they have a history with me. Yeah. And they trust what I'm going to tell them, that I'm going to say, we don't know what it means, or we do know what it means. Yeah. And the reason I have a history with them is I go to a lot of meetings that don't have to do directly with medical care. But don't do that if you're studying for boards. You know, you have to look at your life a little broader than just what's going on in these 4 years. So when you're studying for boards, you probably won't be going to those weird meetings. You hopefully not. You'll be studying for boards and doing stuff with the medical school. But you'll find some opportunities to do other things.
That's super helpful. You know, I personally could ask you a billion questions about just your whole life, because every time I hear something new.
It's only because I'm old. You all, you know, the older you get, you have more shit to talk about.
Every time I hear something new that I'm like, I wish we could talk about that for an hour. But instead, I think I'll open it up to questions from folks on the call. If you've got any questions, I know we said before to keep muted. That was really just to make sure that we could keep the flow of the conversation, but we've got open time now, so feel free to unmute yourself and ask a question.
And I'd like to hear what people are working on also. So even if you don't have a question, if you want to sort of say what you're working on, or.
Yeah.
How can we use you can unmute, but I'll read this. How can we use our unique stance as medical students to demand accountability from those? Let me go back in here. So you know, every group, quote unquote, is unique. So that I want to be careful with that word. Yeah. If what you mean is, how can we leverage the little privilege you have, which will grow as medical students, then that's a reasonable thing. But it's not simply, don't think of what we're talking about as transactional. I guess that's what we're saying. It's not like your ability to change things depends on understanding the structures and changing the structures. Let me put it a different way. If one of you were dean of the medical school right now, there'd be a real limit to what you could do right now. Okay, if you had your same attitude, your same, you know, if I was the dean of one of the medical schools in Chicago, I couldn't change everything all at once. Okay, it's not possible, because if you really believe, as I do, that these things are more determined by the structures that we set up, by how we sort of build the molds for these institutions, then you know that the personality of whoever's in charge is probably not as important as that mold. So now, what is it? I forgot. One of the exams is going to be pass fail, right? Do I remember that right? Part 1.
Yeah, step 1. Okay,
step 1. All right. So now, I would, if I had a choice, I would prefer to make the MCATs pass fail. But you know, but just that one change alone, though it's an important change, because it doesn't do that much. Because when I was a medical student, it was for all practical purposes pass fail. That is to say, you weren't dismissed from a residency because of a score on part 1. Okay, that's something that's evolved over time. So when you're in an organization of physicians or medical students and you say something, for example, the American Academy of Pediatrics, there's a perfect example. The last time I looked, they weren't a bunch of radicals. They issued this proclamation on racism and the impact of racism on kids. That's an important thing. Do I think that everybody in the that is a pediatrician knows what racism is? Hell no, they don't. Do I think the people who wrote the statement and signed their name to it? No, I know better. But it's there from the American Academy of Pediatrics. And you can use it, and I can use that when you're dealing with a school system or teachers or other, to say, yo, this shit hurts our kids, even though everybody should have already known that. So yes, I do think there are things that we can say as physicians that when other organizations say them, it doesn't have the same weight. And that does not just mean, you know, don't use Clorox to treat COVID-19, though obviously we need to do that too. So to go back, for example, to the county strike of 75, I was a medical student and we used to have grand rounds for all the surgical programs in the city. Came into Hectone, the old Hectone that's not there anymore, on Saturday for grand rounds for surgery. Because I didn't do my surgical rotation at county, I was at Illinois Masonic. And we came in one Saturday morning, and I knew, because I knew house staff, I knew that they were thinking about having a strike at county. But in walks all of the county surgeons, the trauma surgeons, the general surgeons, you know, white men, you know, they're stereotypical surgeons, even more so then, but they all had black armbands on. And I'm like, I said, well, why you all have that black? They said, we're going on strike. So right away, as an organizer, I'm saying like, oh, the most conservative bunch of assholes are going on strike. They're going on strike. Yeah. Okay. So again, when you have medicine moving on certain things, when you have the pediatrician saying racism is a problem, that's an important step. So definitely find ways, but don't think of it as demanding for the dean to do something. Think about how you want to actually change the structures, even if it's a small change, like making one part of it pass-fail. And if you study carefully, so for example, let's see, you all are, many of you are medical students. So my understanding is, I don't have this data in front of me anymore, but with the merging of the osteopathic residencies and the allopathic residencies, and who the hell knows what's, we're going to be in a position where we may not have enough accredited residency positions for U.S. graduates. It's going to be really close and tight. So you might see the percentage then of reasonable places to train shrink. And so that's something you should be thinking about now and asking yourself, why is it structured? Why are the residency slots structured the way they are? Why are they financed the way they are? Does this make sense if we want to train good clinicians? Is there a better way to finance and train people for these various specialties?
Yeah. I just wrote that down. I want to look into that.
I don't think this is a question. I actually don't know what it is, but I guess the thought of like what to be worked on. I think there always feels like there's so much to work on. And I think in this period of time, the uniqueness that's offered to folks in clinical spaces, to me, really just feels because of COVID. How to make connections that people in the public should be seeing now. And I feel like there's room to work on having campaigns around like defunding CPD and restoring the city of Chicago's like mental health clinics, and having active discussions about why the county jail is the largest mental health care provider. I think when it comes to doing that work though, I feel lost without mentorship, without knowing even like where my gaps are to like read and learn and make sure that I know what the system is that I'm working against. I feel like I had a strong understanding of that in college. I knew exactly what the org chart was, who did what, where do you take the march to, but when it comes to doing that type of work to push for healthcare access, I don't know where to go or where to start. And I think that's just me speaking very frankly about having the ideas, but not knowing what are the pieces to getting there. So I don't know. Yeah. I'm stream of conscious.
No, that's okay. So the first thing I would say is, for let's just talk about this for example. I'm not sure what you all's position is on abolition. We'll come back to that in a minute. But there are organizations that are working around, in spite of COVID, there are organizations that are working around health for people that are incarcerated forever. So one of the first things to do is to start with those organizations. You can even start with those organizations online, nationally. What are the demands people are making for incarcerated populations? Do they make sense? Do you agree with them? Do you not agree with them? And one thing I think that's very useful, if it's at all possible, is have a group of people that you can honestly disagree with. Okay. And not be afraid of that. So for example, unlike many of your generation and some crazy people of my generation, I'm not an abolitionist, for example. So then if you examine, should we abolish the police or not? What does that mean? What do the abolitionists mean? Why do some people disagree with that? That exercise is useful. It helps figure out where you could begin to work. So if what you want to do is just work on, I don't mean just, but if you want to focus, for example, on incarcerated populations, there are lots of organizations that are doing that at every level, from organizations that do visitation. For example, we were just talking about an organization last night that's trying to transition their work, that work with women who were pregnant and incarcerated, and supporting women who were pregnant and incarcerated and fighting for good clinical care for them, etc. Down to broader issues. So you're lucky you're around a big jail, and if I remember correctly, you're at UIC. One question, I don't even know if we let people rotate through the jail. I should try to find out, but it's a hassle to rotate through the jail. But that might be possible if you're really interested in that. That might be possible for you to do. But there are lots of organizations, from police accountability organizations and the John Howard Association. There are a bunch of organizations that work with that. Again, you don't have to say, like, I'm going to work with the John Howard organization forever. You can work there. You can work with them for a time till you, in fact, figure out what you really want to do, or what the real issues are, or what you really want to work on. So there are other people around. Don't assume just because we have an MD that we should come in and be a leader. So I think that's part. I'm not saying that's what you were saying, but that's part. Be willing to be humble enough to figure out what's going on in a certain area. It's often, like with the issue of abolition, it's often more complicated than it sounds. So let's talk about abolition as an example. First of all, is there anybody here that's also not an abolitionist? I'm just curious. Okay, so why are you all abolitionists? Help me understand. Nobody wants to say anything?
I'm allowing other people to talk before.
Yes, okay. Maybe everybody's neutral. So that becomes an important, so that kind of example, having a position, or defund the police. So I feel much more comfortable with the slogan of defund. And I'll just tell you quickly, I'm not an abolitionist because I think some motherfuckers need to be in jail, not the ones that are there, but some other people. So my problem is with who's in jail and who puts them there. But for example, with the defund the police vote, you remember that was a 4-3 vote on our Board of Ed. And the chairman of the Board of Education is Miguel del Valle. Miguel del Valle has been an activist around education issues forever. He also was a state senator for many years, but his real issue that he first began to organize around, and for which he's known the most, is education. And he came out and said, I want the police. And he's a I will say, in my opinion, he's a progressive Puerto Rican. His position was, I want the police in the schools. And he also said, which actually is a story I had already heard from him, when he was in middle school, he was ruthlessly bullied for several years. And there was no adult that could help him and stop the bullying. That's what he said. And I'm not, he's a sophisticated political thinker. My point is that the reason he was for not defunding the police was not a black-white issue. It's a more nuanced issue. Just like when you talk about abolishing the police to people that live on the South Side like I do that are old like me, then they're saying like, yo, so then when I go to get my paper in the morning, some young thug is gonna hit me over the head and, you know, rob me, which has happened certainly to me. So, so being able to think about and talk about these issues to other people, not to the people you normally hang out with, you will often get surprised at what they think or what they want to work on. So don't assume just because you're interested in something that people that care about that same area may have something completely different that they want to work on, like changing visiting hours for kids or having transportation to the state prison, which is harder to get to. So being able to hear and listen and just like we do when we take a history, being able to listen carefully to people and try to understand where they're coming from, even if we think we disagree with them, or even if we really do disagree with them, that's the first critical skill of an organizer. But no one wants to talk about why they're abolitionists, huh?
I mean, I got thoughts, but I'm like, I'll let other people say something if they want to.
I mean, I think this goes back to Dr. Murray, what you were saying before on like developing a political analysis. You know, I think that to your question, I can answer it. Why I identify more so as an abolitionist, I would say. It's not, I don't think always black and white is that too. But when you don't have your own political analysis, you can't rely on another group of people or other people to be that analysis for you. You have to be your own. And I think that in this moment of time, like people need that knowledge, or that knowledge has to be spread or shared and like talked through because it's difficult. You know, I think that even when people throw around words like restorative justice or transformative justice, what that looks like or what these things look like in practice is a lot harder to imagine than it is to just say.
A lot of times you'll be taking positions because people that you feel an alliance with have that position. That's going to happen more frequently than you want to admit. So don't be afraid of that. And there's nothing wrong with that. You have somebody like me around, and that hopefully you'll stop and think about, well, why am I really an abolitionist?
I see abolition as part of like also just like where I like to follow the money. So we look at where our money goes in cities, in the country. If we look at any city, it feels like every city is like a group of jails and like a big police department, and then like several underfunded programs elsewhere: education, public health, housing, food, any other kind of service, all of that's actually helpful to the public. All of that is underfunded. And then you have like anywhere between 20 to 40% in most large cities going towards the police alone. And that doesn't include the budget that goes towards prisons. And I think for me, I think the other pieces of it is like how that's also linked to labor. Like there is and I think this is the part that you said, like, you know, there's a lot of people still working out, like, what does it mean when you're like actually afraid for your life, and like, who do you call in that moment to like respond to that crisis? And I feel like, I don't know if I would call the police in that moment, because I don't know if the police really make us safer. If we look at crime statistics, they've stayed relatively the same, but we've increased police funding. So it's like anywhere else you would look at that, you wouldn't put more funding into a specific arm of healthcare without seeing evidence that it's worth continually investing in. And I just feel like with this, we tend to just keep our blinders on and decide that, yeah, we're just going to keep on increasing funding. I think the other piece of what I was saying connected to labor is that a lot of the materials, a lot of the different goods that are manufactured in the United States, well, first of all, most things that are manufactured are either manufactured outsourced from nations that don't have the same labor laws, and that way the those people can be exploited, or it's prisoners so that they can be exploited. And so we see that part of like, when we look at prisons, they work as another site of labor exploitation. So it's like, for me, that's when you mentioned like, you know, having that same political analysis, I see, for me, that's why I want to abolish that. But I think part of abolition is also being willing to find ways to, when you break something down, you also got to have a strategy for what you're going to build. And I think I'm still in that space, as you said, it's not all black and white. I'm still in that space of trying to learn what does it look like to rebuild? What does it, if you want to tear it down, what do you put in its place that doesn't just replicate the same thing? And I'm still working through that. There's a lot of literature I still got to read, and there's a lot of people I still got to talk to, but that's kind of where I'm at with my beliefs.
So the only reason I bring this up is, again, this process, and this happens with every issue. It doesn't matter what it is, you know, to really try to, it helps you figure out what you're thinking and why you're thinking what you're thinking. So I only have one or two comments to make, and because I really don't want to have a debate about abolishing the police, but I want to talk about the first abolition movement we had in this country to abolish chattel slavery, and point out that simply being an ardent abolitionist didn't mean that you were anti-racist. For example, we had many, many stone cold racists that were abolitionists, that were against, in fact, I would argue most people who were part of the abolitionist movement internationally as well as in the United States were racist. So just keep that in mind.
Sure.
And then the second thing I'll say, which is just the history of this is, I forgot the sister's name, Gilmore, is her name Gilmore, that convinced Angela to be an abolitionist. You know, so really the debate that I would have with my abolitionist friends is a tactical question. It's not a question of principle. The cops are doing what they're supposed to do, which is kill us. I mean, that's what they're supposed to do. So people that say, oh, we should abolish them because they're not doing, you know, they were never social workers. They're not meant to, they're supposed to keep us in line by physical force, period. And they're doing a damn good job of it. So like, don't defund them or abolish them because they're not doing their job, because they are doing their job. It's just that we don't want them to do their job. Yeah. And it doesn't matter. It doesn't really matter to me. Like I said, Angela commented the other day that abolition was an aspirational goal, and that she said, we never thought this would be on the table like right now. We thought we would be long dead before it was on the table. Well, it's, you know, now more people are picking up this slogan. That's okay, you know. So it's like saying, do you support single payer or not? You know. Well, now in this generation, you say, well, yeah, we support, but that's such a mild reform. I support single payer, but it's not. It doesn't excite me in the evening. I mean, this is not going to fix American medicine just to have single payer. So that's really the point I'm trying to make. And it's okay. You don't have to agree on everything, but try to be self-aware of what your position is and why your position is the way it is. And why, and more importantly, why people that you disagree with, why they think the way they do, you know, and that often takes some work. So there are lots of issues that you're going to have disagreements on, and that's okay.
It's a good exercise in self-reflection. That's for sure. Yeah.
Let's see. Somebody got their wisdom teeth. Yeah. Yeah, it's not. More importantly, it's like by the time you could abolish the police, you should have already abolished capitalism. I mean, I'm just like, why would you start there? I mean, you know, anyways. And by the way, this I will say, don't just take the police budget. That's not enough. Taking the police budget is not enough money to do what we need to do.
Yeah.
Even taking the military budget, which is a hell of a lot more than the police budget, is not, you know, so we really have to, you know, if we really want to fund human needs, the police budget is too little to ask for.
Yeah.
So.
I want to take it all, but yeah.
So what other activities are you all working on?
question.
Have you all been in contact? So the M2s have been in contact with Brittany. What's her
Brittany.
last? James. Yeah. Have you all been in contact with her?
Yeah.
Okay.
Yeah.
So I don't know what. So that's an interesting question. What's going to happen with that? With what's going on with that curriculum?
Yeah, unsure. It's
Okay.
all of it's very nebulous right now. Esther here saying, you mentioned the mold/structure is important. What can we do to build such a structure, specifically during M1 orientation? How can we create an environment that encourages discussion and change? Esther, can you elaborate on why you see M1 orientation as a specific place where you feel like we need to make structural change?
Yeah, I'm an M2 at Rising M2 at Rush, and I'm part of the curriculum task force to make some changes through M1, M4, and in residency as well. But M1 orientation is the first thing that's coming up. So we are trying to make some changes, and I wanted to hear your thoughts on that.
Well, there's a difference between changing the orientation, which is not a bad thing to do. It's a good thing to do. And actually changing the M1 year. Okay, so structural change in the M1 year, things like what's required, what's not, what are the assessment tools that are going to be used to decide whether people can go on to the M2 year. Those are structural issues. So that's the first thing I would say. I don't know if Rush is doing. U of I and Northwestern for some reason decided to do this one school, one book stuff, and they both, maybe the deans are talking. They both picked the same bad book, Just Medicine.
Yeah.
Which is not my favorite. It's a book that talks about implicit bias. I don't. It's not that it's a bad book. It's not the book I would pick for this particular instance.
Yeah.
So I don't know if Rush is considering anything like that.
Yeah, we have a summer reading, and I think we're keeping The Death Gap by Dr. Ansel.
Well, that's better. Yeah, that's better than I think than talking about implicit bias. There are other, but there are other. So one thing is that kind of issue, but I would push for some other changes in the first year. Again, I've lost track of where your curriculum exactly is, but you want to have something that's seen as a full-fledged part of the curriculum, not an extra, not an optional activity. If you want it to be structural, and to me, again, it would be something that changes. Is there something about this incoming M1 class that when they finish 4 years from now will be different than what you all went through in terms of assessment tools, exams, etc. Required courses. So it's not going to happen all at once. Again, I'm not sure how you do your orientation. One thing that we used to insist in my day at U of I is we would do a separate, without any faculty around, a separate student-to-student orientation. Okay, we just kicked the faculty out, and we said, so-and-so's an asshole, he tries to fuck with you on his exam. Well, we just said that, just like a lot of colleges have. And so that's one way to start. The other thing is model. The M1s will make a difference if the M2s and et cetera model a different kind of behavior. So that's not an easy, quick answer, but modeling that kind of information would be good.
Thank you. That was really helpful.
Hi, Dr. Murray. My name is Shana. I'm a UIC Family and Medicine resident just starting. Thank you so much for everything. This has been incredible. Kind of related to Esther's question, another thing that folks have been working on, students specifically and residents as well, is around defunding or de-escalating like hospital security and shifting that towards like de-escalation teams comprised of like social workers, mental health workers within hospitals. And I would just be curious to hear your thoughts on that.
Yes, I think that's a great place to start. Now, I can't, at county, our people are actually police, and they get the same training as the county sheriff. And I'm gonna tell you, when you call county security, that we have some excellent people in county security, but when you call county security, it's like calling the police. So you don't call security if you don't want your patient to get jacked up. I don't remember UIC. Isn't that private? They're not state police or anything, right? So that's a good, and they don't have guns, right?
At Rush, they do. So I'm originally a Rush medical student. They do.
But not at UIC, right? So you're already a step ahead.
Yeah.
Try. So that's good. I would try. One thing I would argue is I'm gonna leave aside of their uniform and stuff. One thing I would argue is they should have special training. At Oak Forest Hospital, which used to be our long-term care facility, we did have security people there, but the whole staff, people lived there. That was their home. So then it's a little bit. But we had actual training of the staff, residents, and the police about de-escalation techniques, etc. So one thing you could argue is, can these people be paid different and like more and get specialized training because in a hospital setting, you're going to have family members that are distraught. You want your police to be able to deal with that. You're going to have lots of things going on that you may want them to have some extra training for. So one thing is to fight for that. Because that's very useful. And to have a relationship between the clinical staff, the ancillary staff, and whoever your security people are, so that you're working together as a team, so they're not out of control, and that people can work together and you can get the right resources where you want them. But that means a more of an investment in what they're doing and how they're doing it, what kind of training, how many of them are around, all of that kind of stuff. I know in our trauma unit, for example, where we often have people from one gang or another, it's an interesting thing. So in county's trauma unit, you want both there. You want them to have both sets of skills. You want them to have police kind of skills, because they got to be able to keep the rival gang from coming in and shooting your patient, which occasionally there's an effort to do that. But at the same time, you need help with, a mother that's falling out over the floor because their baby has died. So, because some adolescent young person has died. So, so to me, that's sort of a special niche. You could pretend they weren't police. Pretend you took orderlies. Pretend you took your transportation people and had a special cadre of them that had special training in this kind of stuff. And you can think of it a different way. You don't have to go the police route. So that means fighting for better pay for those kind of tasks, deciding where you really need them. Emergency room, for example, would be one place where you needed them, and what kind of training and how you keep that training up. So those are all things that make structural differences in that institution. In our clinics at county, for example, we have sort of rent-a-cop, and they usually are not armed. They're like security people that you see at a Walgreens or something. But they also vary in their training. And it really depends on who they are and how they're trained. And unfortunately, we've had one of them die in one of our clinics, when I was still working, to be actually shot and killed. This issue of security is an important issue, but you need special training in a medical setting, in my opinion, to really have it done well.
I appreciate that. Thank you.
Yeah. Somebody's saying they do have guns at UIC. Well, see, now that's something. I mean, to me, I would try to get. Let me not go into that. That makes me nervous with people having guns. But so other issues that people are working on. So one thing, let me just say one thing. One thing is what Mile Square is doing in all of its satellite clinics. What are they doing? The university, I've been working on this on some advisory committee and but the university's position on people without undocumented people without insurance is bad. and they historically have said that they can't. For example, this is how this came up. They had a big grant to do mammogram screenings. They would screen the patients for mammograms, and in a public health sense, you don't have a screening program unless you're prepared to deal with positives that you find. So UIC was screening people for mammograms. They got this big giant money to do it, but they weren't prepared to take care of the women who turned up positive on mammograms that were undocumented. Because we had a program at that point that would take care of you if you were just poor. It could but if you were undocumented, it wouldn't cover you. And they would try to dump these people on county. So we raised, the advisory committee said, well, wait a minute, this is unethical. This is a violation of public health ethics. And we actually did our homework, and it turns out, which of course would never be the case, but it turns out that if UIC did mammograms on every undocumented woman of the appropriate age in the state of Illinois, and the cancer rate was what it is in the rest of the population and that we'd have under 12 cases a year. Of course, we would never have all the cases. It would be under 12 cases, 10 or 12 cases a year with breast cancer in this population. And our position was, you got all this money for this screening program and research, you could afford to take care of those 12, which you would never get. It'd be unusual if you got more than 4. But we didn't get a clear answer, because that's the business office answering that kind of stuff. So those kinds of issues are things that people can do. Knowing how U of I is seen in the community. So I forgot there's a housing project near Miles Square on Roosevelt Road. Most of those patients don't go to Miles Square, okay? Most of them come to county. Knowing that older Blacks in this city still call UIC research. You'd ask them, well, I go to research for that. I mean, because it used to be Illinois Research Hospital, and they still see it as Illinois Research. So having some sense of how UIC is viewed in the community becomes important, and wondering how you change that. So those are all perfectly reasonable projects. On the other hand, there's some good projects that are going on that sometimes people don't know about. So there's a nice pipeline program that's been running out of the emergency room for a few years. I forgot what they call it, CHAMPS or something, I don't know. Anyway, so there are lots of things that people can do around the medical campus.
Okay, just to be mindful of everyone's time, we'll cut the recording here.